It is hard to accomplish anything without a plan. Decorating your house, cooking dinner, or running a business all work better when you have a strategy to get the job done. The idea behind strategic planning is to look at your objectives and your assets and map the best path to arrive at your goals. A good strategic plan helps you figure out where to allocate your time, people, and money. Now imagine creating a plan for a large organization with hundreds of employees and thousands of clients. This organization has a global presence, works with governments and healthcare organizations, conducts research to advance nursing and science, and implements new knowledge and technology to improve patient care. Now imagine coming up with a strategic plan that aligns all those people, needs, and differing objectives together. It would be a daunting task, right? Well, that is exactly what has been happening at the Duke University School of Nursing since fall of 2015. And after much time and effort, the plan is ready to roll out. Dean Miriam Broom says it was a necessary step to keep DUSON's place as one of the top nursing schools in the world.
I think every organization has to set priorities, or the priorities will be set for them. And it's really important to build your priorities on what your strengths are. If you're really lucky, you can set priorities that will build on current strengths and then maybe stretch you a little bit. But there's no organization that has unlimited resources, not unlimited fiscal resources, not unlimited human talent, which is probably the most important resource there is. And in today's world, there are so many demands on nursing, clinical practice demands, academic demands to produce the nurses of the future, research demands. We have to produce knowledge that nurses can use and other health professionals can use that will improve the health of our citizens. Global demands, there's requests from all over the world to have DUSON involved. And there are so many demands that there has to be a way of having the intellectual talent and social talent in the organization say, this is really where we want to go. This is where we think we can best accomplish our mission. And we are going to put resources to the priorities that we identify.
The strategic plan represents a roadmap to build on DUSON's past successes and guide the school toward a bright vision for the future. The planning process included faculty, staff, students, and alumni, as well as Duke Health and Duke University. In fact, more than 6,000 people were asked to participate in the work. Dean Broom says every group had a role in crafting the plan.
The strategic planning process from the absolute beginning was intended to give us as much information as we needed and as many different perspectives as we needed to chart our future, to plan for our future. So we included and heavily involved our faculty and staff. We invited students to participate with us. We also invited alumni through a survey that we sent out. And we also looked at other benchmark schools and did interviews with the deans of those schools in terms of what did they see in terms of our strengths and where we could go and what we should build on. We also had the leaders on campus, Duke University, as well as the health system be interviewed to get their perspective on who could we be, who were we, and then who could we be in the future.
Through that collaborative, integrated effort, the different groups wove all DUSON's components together, crafting a clear vision for a sustainable path to future excellence. Based on all the gathered output, the steering committee outlined 6 overarching goals for the school to pursue. Number 1, prepare transformational nursing leaders for the future. Number 2, lead and accelerate nursing science and its translation. Number 3, provide and promote unparalleled clinical expertise. Number 4, collaborate with the community to advance health. Number 5, take DUSON to the world and bring the world home. Number 6, be the destination for outstanding talent. To fulfill these aspirations, the school has committed to ensuring nursing education is accessible to all admitted students, providing additional innovative global education opportunities, and increasing the number of nurses in influential health policy and healthcare leadership positions. Dean Broom says it will affect the school far into the future.
Well, I think you're going to clearly see that the school's strategic plan built on the tradition of excellence here. There's no question about that. I love telling the story to faculty and staff that I believe we currently have the right mix of experiential and intellectual talent. We have considerable social capital. That is, we have relationships not just with each other, but with the health system, with campus, in the state of North Carolina, and frankly in the profession and the discipline, that we can leverage to influence and shape the profession for the future. And that is not something you can create overnight.
The new vision statement reads, "Together, transforming the future of nursing to advance health with individuals, families, and communities." And the strategic plan outlines a path to achieving those objectives. If you're interested in learning more about the plan, just visit our website at nursing.duke.edu/strategic-planning.